Okay, it's Dr. Buford. We're just getting started on the left knee. We're looking in the medial compartment. As we look above, you can see the articular cartilage on the distal femur, or what we call the femoral condyle. And we can see some areas where it's certainly very thin, if not missing completely, and a little bit unstable there. I'm using the suction on that instrument, which is really just a shaver, just to make sure there's nothing loose. Now, as we look into the compartment, we can see, hold the camera for a minute, we can see this complex meniscal tear that we were expecting. See that? And so we're going to use our shaver just to smooth out as many of these areas as we can quickly. And the rest of it, we'll use a pair of scissors. So you can kind of see how quickly the shaver can work sometimes. Now we're going to use a pair of scissors to get that posterior horn. We'll show you that in just a minute. There's the scissors coming in. We'll keep working here, show you some more in a bit. We're good. Okay, so we've got this meniscus resected back to stable margins. Okay, you can see all the way to the back there. Now we're going to look in a part of the knee, in the central part of the knee called the notch. Just want to make sure there's nothing else really loose here. I'm using the smooth end of the shaver here. You can see that's a little bit rough. We'll show you some more in a minute. Okay, well, okay, so here's the ACL. No, I don't. No, here's the ACL in the middle part of the knee. That looks good. We're going to look in the lateral part of the knee next. Okay, so now we're looking in the lateral compartment. And other than some minimal meniscal fraying on the inner edge, like right there, there really isn't as much wear and tear changes on this side. The articular surfaces look pretty good too. So we may trim up the inner edge of that meniscus, but it's really not bad. Okay, so this is the final compartment. This is the patellofemoral joint. That's your kneecap or your patella at the top of the screen. And then the groove that it glides in is called the trochlea right here, and we can track this all the way down the front of the knee. All the way down here to where you can see the ACL disappearing in the central part of the knee. The cartilage here looks pretty good, right? That looks nice and smooth. We'll look over here in the medial gutter. Nothing hiding out down there. I don't really see much in the suprapatellar pouch, so that's good. There's maybe a little loose piece of meniscus there. We can turn on our shaver and get rid of those pieces usually pretty quickly. Okay, and so we can come over here, we can peek down the lateral gutter. You can come all the way around. So we'll do that in a second. So everything else here is checking out pretty good. I don't really see anything else to worry about. If there's anything else significant that we have to do surgically, we'll come back up on the video, of course. But I think we're just going to fine-tune some little things here and get you back to the recovery room shortly, okay? So good luck to you now. Bye-bye.